Greetings. Good morning. Before I begin the talk, I would like to admit that the reason I'm here physically is because I love this organization. I am in a phase of my life where most of the talks are given by my people, and very well done. But I want you to know that I think you are the future of dentistry. I'm supposed to read something that says I do have a financial interest of a product in my talk. No, I don't. Yes, I'm affiliated with companies, but none of them are going to be mentioned in the room because this is a CME meeting. I'm not used to reading things. I'm actually dyslexic, but that's another matter. So let's get on to the talk. Functional immunology. Most immunology today is red and blue and dead. Most immunology today is based on serum and misleading because it does not measure cells. Cells are the key to wound repair. Cells are the key to successful procedures. Cells are the key to what I'm going to be talking about today. And I would like to advance the slide. Can the AV people help me advance the slide? What? Oh, point it down there. Okay. That means I can come away from the lectern, and I see myself, which is good. You can see what I'm affiliated with, and the keys. Now, one advanced. No, you still see my face, and I would like you to see the keys to sustainable health. I'm going to try again. It advanced down here. It did not advance over there. It did advance over there. So thank you, the AV department, to the rescue. So we're going to understand immune defense and repair. System functions, not just red and blue and dead. In both health, because we can define now what healthy means, and chronic illness. The toxic effects of heavy metals, environmental chemicals, additives, and excipients should be familiar to you, but we will review them briefly. Host hospitality, the individuality that determines whether a patient will have a successful outcome or not. Their vulnerability, their susceptibility, their tolerance or intolerance. We want to incorporate lymphocyte response assays, cell culture assays, in functional protocols for improving healing. And perhaps most important, inflammation is really repair deficit. It is not 5 aspects of a fire to be fought. If you look at immunology and inflammation from a pathology point of view, I'm a doubly board certified pathologist, you end up with fires to fight. If you look at it from a biological or physiological standpoint, it's an opportunity to induce repair. So I want to stimulate repair. I want to inform, motivate, and inspire you to put into practice what I'm now going to talk about. Now, soon, aha! Use the right words. Okay. So, autoimmune conditions afflict at least 23rd, possibly 150 million Americans, depending on how you measure it. 80% of the diagnoses go to women, but that's because if men go with a pain, it's going to be called bursitis. If women go with a pain, it's going to be called fibromyalgia. So, autoimmunity and autoimmune diseases are very common. There are over 100 of them that the ARDA, the Autoimmune Related Disease Association, has defined. Yes, it's the combination of parenting, genetics, infections. Why are you susceptible to infections? I don't think you should be susceptible to infections. Dietary components, deficits in the diet today are rampant, and contaminants in the diet are usual. That means toxic chemicals. Now, there are many microbiomes. Skin, nose, mouth, lungs, GI tract, many microbiomes that defend and repair us when they are able to operate. They are our anti-cancer mechanism. Do you know that you make cancer cells every day, and so do I? But I have by apoptosis, during restorative sleep, periodic impulses coming from the deep brain that tell every immune cell in your body to look for abnormal cells and eliminate them by apoptosis. Aha! There are different aspects to the immune system: adaptive, natural, and artificial. They are not the same. Natural means passive maternal protection. The baby is protected for about a year from the mother's immune system while the baby learns about the world. And active adaptive immune responses reflect what you've been infected to and hopefully overcome from. So most infectious diseases can leave a trace behind, but not be active today. And you need to know, if you're going to address the infection, whether it's active today or just history. Blood, lymph, and tissue systems operate. They utilize memory, and they're antibody-specific, with the emphasis on the T-class lymphocyte cells more than the antibodies. Now, there are about 50 billion dendritic cells, each that can recycle 50 pathogens. That's 2.5 trillion foreign agents can be recycled by the body at any 1 minute if you provide the essential nutrients. This means no allergies and tolerance. This means neutralizing infections and allergies before they become symptomatic. This makes you inhospitable to disease, ensures timely wound healing, and repairs us from daily wear and tear, and defends us. If I turn to the left, advance the slide. There. So this is from colleagues, and they're trying to visualize wound healing, the role of the innate and adaptive immune system. So there's the skin. Notice the multiple layers of the epidermis. Hopefully that would prevent bacteria from getting in, but very often the skin is porous and permeable. You can see that macrophages, natural killer cells, chemical signals, leukocytes, dendritic cells, mature dendritic cells, are very important, because dendritic cells give rise to T cells, they monitor immune complexes, and they can distinguish helpful from harmful antibodies. If you detect antibodies in serum, you're detecting both protective and reactive antibodies. That's confusing. A cell culture can distinguish between helpful and harmful antibodies and reports only the harmful antibodies which activate the cells. So a cell culture is essential to understand wound healing. And I will mention that in a few months we will have 2 chapters in a dental textbook that's coming out by Elsevier on wound healing, and a chapter on toxic metals and how to get rid of them. Now, next. Aha! There are different phases to wound healing. You probably know this already. Blood clots stimulate repair. Inflammation, which means repair deficit, forms a scab. Then fibroblasts and macrophages flow in and stimulate repair. Then proliferation, cell growth, cell proliferation, because of the stimulus of the wound. And hopefully, finally, on the far right, remodeling, freshly healed epidermis, freshly healed dermis, skin returns to being impermeable to harmful things. Aha. With regard to wound healing, Anderson and others have said age. I think age is an illusion. What age means to me is too much bad stuff and too little good stuff to feel young again. And I'll just mention that whatever age I am chronologically, I am functioning at about half that age based on predictive biomarkers and other tests, and I want you to feel and function as well as I do for a long time. Nutrition, we'll talk about that. Comorbidities, we'll talk about that. Medication effects, we'll talk about that. And lifestyle. Epigenetic lifestyle, habits of daily living turn out to be major opportunities to engage with the person and have them make slow, effective makeovers in their kitchen, in their bedroom, in their personal care, and in their environment. Yes, it is possible at any age for people to choose healthier habits as long as you don't ask them to do too much too fast. I didn't learn whatever I've learned over half a century in 20 minutes. I think taking one small, important step is a good start, and you follow it with another step. You know, the journey of 1,000 miles begins with the first few steps. The epidemiological triad, environment, agent, and host. Yes, the epidemiologists say this. This is true for populations, but then you get to individuals. And what is true for a population may not be true for an individual. For example, did you know that most lab tests have a usual range? That range is based on 50 or 100 specimens. That's not many specimens. In fact, that range could be based on a population that you are not part of. So we have reinterpreted important lab tests to their best outcome personal goal value. We don't even look at the lab statistical range anymore. We don't. I actually fold it over so the person doesn't get confused. And then I explain to them, what are the predictive biomarkers that determine your health, vitality, and ability to repair, and why they should be interpreted to their best outcome goal value, not to some statistical range, because they're not a statistic and I don't want to make them into one. You could laugh at that if you wanted. Okay, next. I think it's very important no, back one. Yes, be paid. No, back a few. This is a good test, a stress test for the presenter. It's also a stress test for the AV people, but you can see me. Back a few. Yes, that's it. Perfect. Be paid for value. You are not paid just for your time. You're paid for your wisdom and experience. Determine chronic illness links to toxic metals. If you don't know about that, I want you to know about it well and often. To reduce the chance of treatment failure, to assess body burdens, and to practice safer detoxification, and mitigate the adverse effects of toxic metals. I notice this thing is texting. It's creating a text out of my words. I have to be careful to use good grammar. Next. Aha. The symptoms of toxic metals. Almost everything could be related, often is. Cognitive impairments like early Alzheimer's and loss of cognitive function, headaches, joint pain, fatigue, dizziness, anxiety, autoimmune diseases, self-attacking autoimmune diseases, metallic taste in the mouth. I had a dear friend who had a wife, and for months she felt a metallic taste in her mouth, and I explained several times that this was because toxic metals were coming out of her brain into her saliva, and if she would just persevere with the nutritional, attitudinal, green light program that we instituted for her, it would go away. When it finally went away, she said to me, "Now I can believe you. You need to show, demonstrate, prove that your simple recommendations are important and life-saving." Next slide, please. Now, mercury. You are entitled to, as a citizen of this country, 302,666 micrograms per year of life. Over 50 years, you do the math, the synergy among toxic minerals is about 100-fold. So when you see a little bit of toxic metal, it has a major adverse effect. Mercury binding constant to active selenium is 10 to the 40th, which means mercury and other toxic metals can deplete essential selenium, which impairs the membrane vitamin E and all the metabolic steps in between. If you look on the left, you can see the annual burden added to the American environment is 100 tons a year. Yes, this comes partly from coal-fired power plants, but it also comes from Africa and Asia because the dust over there is massively contaminated, and it comes over the oceans from Africa to the East Coast, from Asia to the West Coast. If you're in between, you're in Cancer Alley, which is called the Mississippi Delta. So we are bathing in toxins, including toxic metals, and you can get rid of the toxic metals following what I'm going to recommend. Next. Yes, 300 million Americans. Next. That's 302,000 micrograms over 50 years. Next. Aha. Where do these come from? Well, amalgams. I'm sure no one here uses mercury amalgams, but porcelain crowns, root canal. Yes, I should mention gutta percha. Amalgam dental materials. You'd be surprised the number of toxins in dental materials, including zirconium or strontium, which we can now measure to find out if an individual has hypersensitivity or not to these and many compounds. Alloys often contain contaminants on their surface. Metal-free dentistry. Is there really such a thing? I think there's low metal density, dentistry. I think you should practice biological dentistry. But if a patient or a person asks you, am I completely 100% free of toxins? You say, first of all, no one is. And second of all, you're a person, you're not also. But you can prevent the toxins from harming you. You can accelerate the removal of the toxins. You can dramatically reduce the exposure to the toxins if you follow this program. Next, please. Benign forms of insoluble minerals. Aluminum as aluminosilicate or aluminum oxide is used in many dental materials. Glass ionomers, ceramics, porcelains. I'm not sure what compomirs is, and ceromirs. These forms are tolerated by most, but not all people. Sensitivity testing is essential to ascertain reactivity. The form of metals is important. Metal salts, or metals that can leach from the surface of materials, is biologically active. A dear friend of mine from long ago, Bob Cathcart, a big advocate for vitamin C, actually made his living on the royalties from the artificial hip. This was metal on metal, and we don't do that anymore because on the surface of the metal, when it moved in the body, it leached nickel and other toxic minerals. And a very bright dermatologist at UCSF named Maybach made an entire career showing that the hip implants should be improved. And I agree. Next, please. Yes, there are multiple factors. Next, please. There's the degree of inflammation. You can probably see inflammation in the gingiva and gums of the body. And guess what? The spit that comes out is not saliva. When I was a graduate student, Dr. Frank Oppenheimer, a dentist from Switzerland, was studying peptides in parotid saliva, pure parotid saliva. All you had to do was put a little piece of plastic called a Kirby cup over the gland in your mouth and wait about 5 hours for the slow, actual saliva to come out. What you have in the mouth today is serosanguinous fluid, inflammatory fluid, diluting the actual submandibular or parotid saliva. Saliva is not a good specimen for measuring many things. It is an excellent specimen for measuring hormones. It's an excellent measure for certain markers of inflammation and repair deficit. It is not a good marker of spit-based tests. I know it's easy, but it might be confusing, and I don't want to confuse you. So next. Host hospitality, I think this is very important. Autoimmunity means a loss of tolerance, which means self-attack due to too much defense and not enough repair. This results in more pain and, importantly, less restorative sleep. I follow the old maxim of early to bed and early to rise. I don't have any devices, including Wi-Fi, in my bedroom. I now get restorative sleep. I will tell you, for many years, I didn't sleep because I thought sleep was being lazy. So I was the first one in and the last one out in my labs at NIH and subsequently my own labs. And I'm glad I've reformed. I'm glad I can now tell you the virtues of restorative sleep. I was chronically sleep deprived and irritable, but I didn't realize this. This was what my family realized. And very early on, Rebecca, the mother of my children, said to me, "You're shouting." And I said, "No, I'm just talking." And she said, "No, that's called shouting, and don't do it." And I realized that she was right, that in my family, if you weren't shouting, you were ignored. So I learned from my family what not to do. Next slide. We want to decrease the turnover of collagen. We actually want to repair collagen, elastin, and connective tissue infrastructure. Stress hormones play an important role. If you have too much adrenaline and too little serotonin, if you have too much imbalance in your hormones, measurable in saliva or in plasma, you need to rebalance the hormone neurochemical system unless you want bad outcomes. If you want good outcomes, you will spend a couple of months improving the terrain of the person. Next, please. Historically, there was CMRT by the much beloved Jess Clifford. We took over testing when Jess passed. We did it exactly the way he did, and we learned that today you need to change and update the methodology. We are now transitioning and announcing today a new full LRA program. This means the mouth is connected to the body and the body is connected to the mouth, and if you have optimized wound repair and optimized hormonal neurochemistry and optimized immune defense and repair system and optimized digestion and metabolism and biodetoxification, the outcomes will be excellent and they will bring their friends to you for help. And if any of those is overlooked or ignored, outcomes go downhill pretty quickly. Next, please. Oh, yes. So, the limit of the Clifford method and the advantage and the ease of the Clifford method was it was based on serum, so it measured antibodies only. For dental materials and for anything, you must have the T-cell information and you must distinguish helpful from harmful antibodies and actually include immune complex information. So, the Clifford technology is now 60 years old. It's static, which means it's non-functional. And it's impossible to distinguish helpful from harmful antibodies. It has high false positives and some unacceptable false negatives. So, we decided to move forward. This is a report that you may be familiar with. This was quite intuitive of Jess Clifford. We're not quite so intuitive, and we need to look at the evidence, including statistical evidence over time. Next, please. So we will soon be offering 46 antigens specifically designed for the dental and orthopedic community. This will measure all the toxic minerals, including aluminum. This will measure other minerals like gold, because gold is never pure and gold always has some contaminants. The question is different contaminants in different gold sources: cobalt, silver, zirconium, titanium, cerium, and more. We will also be measuring the acetates and other antiseptic solutions like benzalkonium chloride, which I do not recommend, but is commonly used. Orthophosphoric acid, again, not recommended, but commonly used. Propionates, which can be avoided, but are hard to avoid. Then other compounds like bismuth, lanthanum, scandium, barium, sulfate. Barium is fairly inert unless it dissolves. So barium sulfate, which is used in clinical medicine a lot, tends to accumulate in the body. Who knew? Next. So we want to guide personal healing and tissue repair and recovery. I've suggested that you start with a 1 to 2 month biodetoxification and immune system restoration to restore tolerance. Follow the LRA restorative wound recovery plan before and after the procedure. This is a epigenetic, lifestyle, habits of daily living, nutritional, attitudinal, environmental plan to reduce the toxic exposure and dramatically increase the biodetoxification in the body. On the left, you see a standard ELISA, kind of like Jeff Clifford did it, but as you notice, it has 3 to 4% variance at each step. It has 5 steps. Therefore, the variance on split samples will be 15 to 20%. That's too much variance for me. We invented in 1983 and have been offering over 100,000 specimens and 30 million cell cultures the first one-step ELISA that's based on a cell enzyme that is inactive in the resting state and active in the active state. We have published over 4,000 blind split samples with less than 3% variance. This is unprecedented for a cell culture, but it's the value of doing a one-step LRA lymphocyte response assay by ELISA ACT. ELISA ACT is different than all other ELISA procedures. There are probably 10,000 or more ELISA procedures. There's only one ELISA ACT. Now, immediate allergies can be measured in serum by RAST testing, Ishizaka, IgE. These are the histaminic reactions. Delayed reactions, which is what the LRA measures, are type 2, 3, and 4. Only harmful antibodies are detected. Immune complexes and vasculitis-provoking things are detected. And most importantly, we get the T cell to talk to us. Hidden or delayed allergies are hard to identify by history and serology because the reactions occur 3 hours to 3 weeks after exposure. So even the most careful diet record is unlikely to reveal the true delayed allergies. Next. These are 4,138 blind split samples with 2.25% variance. This we reported at the academic high priest meeting of clinical pathology in 2016. And we have continued to publish the evidence that cell culture is worth doing and is reliable. Many people will tell you that cell cultures are hard to do. Yes, they require careful control. But we've been doing it for 40 years and continuing to grow. Next, please. Comorbidities, compromised people. If your immune defense and repair system is doing too much defense and not enough repair, you'll have inflammation called repair deficit. There are endocrine and brains. You have a central nervous system and you have a gut nervous system, and they're in constant communion through the vagal bidirectional nervous neurochemical highway. Atopic reactions are surprisingly common. Universal reactors, the environmentally chemical population is growing, and we have had remarkable success restoring quality of life in people that are chemically and environmentally sensitive. Galvanic responses, measuring the electrochemical responses in the mouth, are an art, and it's not something that we know a lot about, but I know enough to know if you have multiple metals in your mouth, you probably have electrical currents flowing that are not helpful. And there are things you can do to mitigate these issues. I mentioned that it's 3 hours to 3 weeks from exposure to reaction. That makes it very hard to get a history. But the patients come in and say, I just don't feel well, and migrating problems, and my get up and go got up and went, and I can't find it. Next. Our method, the ELISA ACT LRA, directly observes the lymphocytes under conditions similar to the body. It's an ex vivo test. It's not an in vitro artifact of the laboratory. It's a direct cell culture, ex vivo, measurement of all 3 delayed allergy paths, and it's an advanced method with few false positives, and intolerances, immune reactivity, hypersensitivity, can be then detected and digestion strengthened, biodetoxification enhanced, and you restore the person to life. And generally, they are very grateful. Next. Very often, people will say to you, it's hard to read a cell culture. On the left are non-reactive lymphocytes. On the right are reactive lymphocytes. Around every reactive lymphocyte, but only the reactive lymphocytes, you now see a halo. This is not spiritual. This is physical. I want you to know that in our lab, and come visit our lab, you can look at the digital microscope images on the screen and so forth. We have no difficulty distinguishing reactive cells from non-reactive cells. If you measure indirectly, as most people do, using fluorescent or other kinds of additive detection techniques, probably it won't work so well. So we've worked this out. We purify all our own antigens. We make our own plates. We do our own tests, and we are here to serve you. Next. We can measure over 500 cell cultures on an ounce or 2 of blood. This covers the largest number of foods, additives, and preservatives, the largest number of environmental chemicals, toxic minerals, or what's called heavy metals, medications, molds, dander, hair, and feathers, even herbs. We try to be as complete as possible. We have various levels of testing, more complex and less complex. You can choose the right one for your clients. You have a balance in your immune defense and repair system between defense and repair. What if you increase the defense work? That has to come first. You have to defend the body first. That means that repair will go down and inflammation will go up and autoimmunity will emerge. Healthy means an ability to defend and repair. It means tolerance, resilience, and balance throughout life. This is the slide that says, what if the defense goes up, the repair goes down? There's a critical need to tune up the immune defense and repair system now. It's under unprecedented assault. Precision, reproducible, comprehensive testing and clinical knowledge of how to recommend a 3 to 6 month restorative program are what we have been perfecting and providing for 40 plus years. What we do is spin the sample gently. We get the red cells out, but we have all the cells and the plasma and the platelets left behind. We had to develop a novel microtiter plate so that the cells would be viable. We have 48 wells on each plate. We have one or more plates per specimen. Each well is pre-coated with an antigen to be tested. We incubate at body temperature for 3 hours, and then we observe directly under the microscope the reactive cells. Food and chemical sensitivities and intolerances can be detected. Leaky gut and microbiome distress can be resolved. Evidence of chronic autoimmune illness potentiated by toxic chemicals and environmental chemicals you can deal with. As I've said several times, inflammation is really repair deficit. And when you remove the toxin and immunotoxin load, the body responds favorably. Comprehensive detoxification and immune repair are what we suggest. Safer bio-detoxification using foods as natural detoxifying agents, I'll specify. It is about what people eat, drink, think, and do. So if you nourish tolerance in the immune system with a personalized lifestyle repair program and proactive primary prevention, you're contemporary, you're in the moment, you're in the 21st century, which is an unprecedented toxic exposure and unprecedented ability to bio-detoxify and avoid harm. Next. So 75% of the immune system is within the gut. And what you see on the left is a healthy intestinal lining, which is very variegated. It has a large surface area. The surface area of a healthy small intestine is as large as a tennis court. The surface area of people with enteropathy, which is very common today, are less than the surface area of a tennis court, which means they cannot absorb many of the nutrients you're giving them unless they're being given in highly bioavailable forms. On the right, the result of inflammation, you see the damaged intestinal lining, the lack of surface area, the leaky gut with parasites and harmful bacteria coming in, with yeast and fungi coming in, with toxins coming in, with undigested food particles coming in. Next. So, we have a quintet. We have a digestive quintet. These are 5 separate digestive support aids. Digestive aid is 3 drops in anything wet and warm to start the meal to stimulate stomach digestion. L-histidine, the source for the protons, because most people have too little stomach acid, not too much. If you take L-histidine 30 minutes before a meal, at the meal time, you will be at the peak level to convert histidine into stomach acid, not histamine. And actually, most of the histaminic reactions to histidine are due to medications, not physiology. We have long recommended prebiotic fiber, following Dennis Burkitt's guidelines, 40 to 100 grams a day. The average American gets about 10. Probiotic bugs, 40 to 100 billion CFU, live bugs, not dead bugs. I want to know how many bugs are alive when you take them, not when they were manufactured. Symbiotics, recycled glutamine. We pioneered and have globally patented the fact that if you take 1.5 grams of recycled glutamine with PAC to recycle it 10 times, you get the benefit of 15 grams of glutamine without the impairment of the glutamine aspartate pathway. So we stay within physiology all the time. We measure, no, next please. We measure the GI transit time. The average today is actually 48 to 120 hours. It's actually extended. The healthy transit time is 12 to 18 hours. What you eat at night should come out in the morning. Short bowel does exist. That's where Doug Wilmot made his career. If you have less than 10 hours transit time, we can deal with the short bowel syndrome. But you want the Goldilocks scenario always. You want healthy 12 to 18-hour transit time. You can measure digestive transit time easily. Next. Where do those toxic metals end up? Where do they cause the harm? The basal ganglia This has to do with things like cognition and memory. The choroid plexus. The choroid plexus should pulse spinal fluid every few seconds. That's called a craniosacral pulse. It's absent in people that have toxic metals, and someone showed years ago in the Journal of Nutritional Science in the United Kingdom that toxic metals concentrate in the choroid plexus and also in the kidneys. Have you noticed that chronic kidney disease and accelerated kidney disease is increasingly common, especially in people that have not had their toxic metals tested by the depenicillamine protocol? Neurons are destroyed. The substantia nigra, a very important part of the brain, atrophies. Inflammatory cytokines come up, interleukin-6 and TNF and others like HSCRP. The valence, the charge on manganese, iron, copper, can all be above physiology. They can all indicate oxidative stress. Or you can have enough ascorbate, polyphenolics, magnesium and choline citrate to keep them in their low valence, biological, healthy state. If you want to look at a report, you can look at the fact that increase in these industrial environmental chemicals is more than 15-fold, which is 1,500%. In pregnant women today, they have in their cord blood over 43 xenotoxins. We have very little information about the interaction of these harmful chemicals. We know they should all be avoided. Next. Biodetoxification. Stop fighting with disease and restore detoxification. Phase 1, phase 2, phase 3, and we have a supplement that supports phase 1, phase 2, and phase 3 detoxification. How about what's called GGOBE, garlic, ginger, red onions and shallots, broccoli sprouts, brassica sprouts, and eggs, but eggs mean duck eggs and quail eggs. I'm sorry to tell you that chicken eggs, even organic, and chicken, even organic, has too much arsenic, microplastic, and other toxins in them. I do not eat chicken eggs. I don't. Now, glutamine should be recycled by pack. You should have sulforaphane, which is a helpful biodetoxifying element, IP interleukin-6, and enough minerals to keep these comfortable. Next. We come to the C cleanse, the C ascorbate calibration. You either take half a teaspoon, which is 1.5 grams, or a full teaspoon, which is 3 grams, or 2 teaspoons if you're chronically ill, which is 6 grams, every 15 minutes. That means 24 grams in an hour, and within an hour or two, almost everyone will cleanse. And when it takes longer than that, have them stop, talk to me about how to redo the C cleanse the next week more safely. We've used this in thousands of people, including people scheduled for surgery for ulcerative colitis with success. We've had very few complications if you just follow our suggestions. Next. I could give an entire 1-hour talk on vitamin C ascorbate, but nature's ascorbate. Now, 1 gram of ascorbate will basically help remove from the body the 10 micrograms a day that you get, and the first 2 grams will remove the 20 micrograms that you get as an inheritance as an American. The average American is receiving 20 micrograms of toxic metals a day, some more, some less, but they all should be out of the body. Recently, I heard testimony from a CDC pediatrician, and the question from the senator was, when we see lead in the blood, what is the level that's safe? And she said, when we see it in the blood, it's too late. There is no safe level of lead. Now, when I was a young doctor, 50 was the level of lead acceptable in Boston. Then it went to 25, then it went to 15, then it went to 10, and I think it's now 5. And I will tell you eventually it should get to 0. Next. D-penicillamine, an amino acid. Next. Yes, it chelates divalent cations, all of them. It stimulates nitric oxide production. If you want nitric oxide, D-penicillamine is a great way to get it. It increases your sulfur phase 2 detoxification pool, and it's synergistic with phase 1 and phase 2 detox. There are many oral chelators. They all have problems except for D-penicillamine. D-penicillamine is a simple amino acid. It's dimethylcysteine, it's mercaptovaline. It goes in and out of every part of the body, and it does not deliver the toxic metals to the loop of Henle in the kidney or to the choroid plexus in the brain, which most of the other agents do. So, what I recommend for personal detox is urine testing for D-glucaric acid, mercapturic acid, and sulfate. These are 3 aspects of bio-detoxification. And do the D-penicillamine provocation to get essential and toxic minerals when you want to. So what is this D-penicillamine all about? The pharmacokinetics of ascorbate and D-penicillamine are harmonious. They work well together. They are therapeutic. They provide an enhancement to biodetoxification. They should not be used alone. They should be used in conjunction with the other biodetoxification. We prefer to provoke into the urine the minerals with D-penicillamine so that we can combine biological detoxification with post-D-penicillamine as needed, like Monday and Thursday. You never give D-penicillamine every day. It will prevent connective tissue cross-links. But if you give it Monday and Thursday, on Tuesday and Wednesday and Friday and Saturday, the cross-links can form. We figured that out years ago. So you want to enhance phase 2 detoxification using sulfur compounds like cysteine and methionine that build glutathione inside cells. Glutathione does not get taken up by cells. Glutathione has to be made inside cells. We recommend GGOBE as the biological, delicious, nutritious detoxifiers. We add D-penicillamine if and as needed to enhance antioxidant repair. This clinically repairs all the organs of the body. We have seen eGFR in the kidney go from 25 to 30 up to 50 or 60. If it goes below 25, you're in trouble. So this is on the edge of increasing trouble, reversed by biological detoxification. Next. How do you quantify toxic minerals and the immune burden? Do the D-penicillamine provocation to get the physical chemistry, the amount. Do the LRA testing for cell culture, for hypersensitivity. On the right is a lymphocyte that's been, it's a scanning electron micrograph that's been colorized. Next. Magnesium. Magnesium is very important to help get the toxic metals out of the body, and magnesium depletion enhances toxic metal effects and uptake. Magnesium is enhanced, its uptake is tripled by choline citrate. So we give between 220 and 880 milligrams per day of elemental magnesium along with teaspoons of choline citrate at each dose. This displaces toxic metals, protects fats. It turns out magnesium is an antioxidant protecting essential fats in transport like LDL. Choline is very important, and so is citrate. Thank you. Go ahead. They're ahead of me. The urine after 6 hours of rest equilibrates with the fluid in the bladder. So for one time during the day, the only time during the day when you get a reliable measure of metabolic acidosis and catabolic illness is first after a rest. If you're too acidic, it means the urine pH will be below 6.5. If you're healthy, the urine pH will be 6.5 to 7.5. If you have catabolic illness, it will be consistently above 7.5. We can help you understand how to mitigate both of those problems. You want a goal value for urine pH of 6.5 to 7.5. This is a chart we created. It's available for download free on drrusselljaffe.com. You want 80% of what you consume to be on the alkaline side when you're recovering and 60% alkaline when you're well. Yes, you can have some of the acid-forming foods, but not too much. How about pro-detox nutrients? Only use nature's ascorbate, fully reduced, fully buffered, and fully available. Most ascorbate is made in the air. That is cheap. But the air oxygen damages the ascorbate, so you don't have nature's ascorbate. We make our ascorbate under a nitrogen blanket, so you get 100% of nature's ascorbate. Polyphenolics. Yes, this is a pomegranate, and any dark fruit or berry is fine, but we also supplement with bioactive, safer polyphenolics. Balanced natural forms of all B-complex. Increase greens in your diet. Have GGOBE be a staple of the diet. And have uncontaminated, micellized, better uptake EPA, DHA, because you probably get too much omega-6 and probably don't get enough omega-3. How about periodontal disease and gum health? There's a 36% increases linked to chronic sleep loss. So restorative sleep is an important part of my dental hygiene. Teeth grinding should be addressed. Dry mouth can often be a sign of Sjogren's syndrome that should be addressed. Resilience, endurance, productivity, output, immune defense and repair capabilities, memory, and weight control. If you follow this plan, you will probably be at your ideal weight. I now weigh, and I have lost 65 pounds about 12 years ago, but I am now at the same weight I was in college. Generally, the weight you should be today is the weight you carried in your early 20s. Mind, body, and spirit are connected. On the left, you see Tai Chi. In the middle, you see yoga. On the right, you see more Tai Chi. I think Tai Chi Chuan, Hatha Prana Yoga, Pilates, Feldenkrais technique, Traeger method, Alexander technique. I have benefited from all of these. I was actually Moshe Feldenkrais' doctor for a brief period of time. Milton Traeger was nice enough to see my daughter when she had a cross-crawl problem in infancy. So I've been involved with the mind-body-spirit connection for decades. Then there are predictive biomarkers. Hemoglobin A1C should be less than 5%, HSCRP should be 0.5, homocysteine should be less than 6, lymphocyte response assay should have no reactions. Your first morning urine should be 6.5 to 7.5. Your vitamin D should be 50 to 80. The average vitamin D in America is about 10. Your omega-3 index should be more than 8%. And your 8-oxoguanine, this is a urine test of damage to your DNA, should be less than 5. So wound healing depends on various factors: the degree of inflammation and ability to repair, wound healing capacity, host hospitality, essential and anti-nutrient, more essentials, less anti-nutrients. Autoimmunity is self-attack. Due to too much defense and not enough repair, you can modify this in a few months. Prompt repair of collagen, elastin, and connective tissue is needed. And please get restorative sleep so that your cortisol and neurochemicals can be balanced so that you can get restorative sleep. In my bedroom, there are no devices and no Wi-Fi. I don't need Wi-Fi in the middle of the night. I mentioned this to my chief of staff, who's from Ghana, and he said, well, I'm often up at 2 a.m. talking to Ghana. I said, I don't have an answer for that. So, in summary, understand immune defense and repair, use host hospitality and vulnerability as an opportunity, manage inflammation as repair deficit, and get the bad stuff out and the good stuff in, restore immune tolerance and overcome repair deficit, better wound healing and biodetoxification. Thank you, and thank you.